Hello, hello, and welcome this evening to our day two of a Myo Advantage Masterclass. I am so excited to be here with you all tonight, this evening. Yesterday, we hit the ground running really hard with a lot of really good content. I plan on coming to you every week with at least one bit of education for you. That way, you can learn all of the wonderful advantages that myofunctional therapy can offer. But tonight, we are talking about integration success. How do you actually get everything integrated into a dental practice? So, first things first, I'll introduce myself for those of you who are unaware of who I am. I am Carice Laguerre. I am a myofunctional therapist and clinical registered dental hygienist. I don't practice anymore my dental hygiene, although I am still licensed in 2 states. I do full time myofunctional therapy. I'm incredibly passionate about it. I help offices implement it, and that is probably the most rewarding thing possible because it's all about the ripple experience. It's all about the ripple effect, right? So every office that starts to implement this now, they're helping people, and those people are going on and thriving. And that's like an extension of my arm's reach. And so I love myofunctional therapy. There's so much value. If you're not on my mailing list, you want to get on my mailing list because I sometimes send out cases. So you get to see what myofunctional therapy does. Today, I sent out a case of a woman that had well, she's a young lady that had a crooked smile. And, all of the work that we were able to do that she wasn't able to achieve with her neurologist, her muscular specialist, her physical therapist, she struggled for years. And it just took a little bit of myofunctional therapy to get her back into loving her aesthetics again. So, very excited to talk about myofunctional therapy because there's so much it can do for your patients, so much it can do for your practice. And tonight, that's exactly what we're going to be talking about, how exactly you can integrate this into a dental practice. Okay. So, yesterday, we talked about how you can elevate your patient experience, and a lot of that, if you didn't watch it, you've got to go back and watch the replay. I gave step by step actionable items of information that you're able to utilize and actually put into play to help you get more case acceptance. And then what happens when you don't get case acceptance, when it doesn't work? You got some information for that too. So now we're going to move on and we're going to see how we can utilize myofunctional therapy in the dental practice. How can we integrate it and get it so that it is a functioning part of what all we really would like to achieve, which is some level of improvement in our professional or our practice service offerings, because that's what this really is all about, right? So we've got 3 things that we're going to cover today. It's the 5 steps to integration. I call it the merge. Then designing the workflow. How is it that we can get it to flow? Because without a system, you have nothing, absolutely nothing. And then the options for each type of practice. So there's various practices out there, right? General, pedo, endo, ortho. There's so many different applications for myofunctional therapy, probably not for endo, probably not for some of your cosmetic dentists. But I will say a lot of great methods that you can use to implement it in a practical way for where your office is now, because that's the most important consideration is where are you now and then where do you hope to get to. If you are in crisis mode and you're just trying to keep payroll, probably not a good time to integrate myofunctional therapy. If you are struggling with staffing, probably not a great time to integrate myofunctional therapy, but there are options. Okay. So not everything has to look exactly the same. And we can discuss all of that once we get closer to the end. All right. So let's dive right on in. Myofunctional therapy and trying to implement it into a dental practice. A lot of people might liken it to trying to navigate a jungle without a path. Can you imagine just in this image here, if you step foot into this location, it almost reminds me of Jumanji, right? If you step foot into this location and there is no path to guide you forward, and they're just like, make it to the other side of the jungle, please. How are you going to get there? How will you make it to the other side of the jungle? Well, a lot of us might struggle through. You might quit. You might say, no, I don't want to do it. Or is it worth it? What's even on the other side of the jungle? I promise you, you're going to get what's on the other side of implementing myofunctional therapy and how wonderful and great it can be for your dental practice, but carving that path out in between that we're going to be discussing tonight. Okay. So you'll see this jungle theme kind of run through. I really love themes. And this was a fun way for me to integrate a good theme into a practice presentation. So seamless integration depends on one thing. There's only one variable that depends on how well you've integrated something into your practice, and that's the focus on the patient experience. If you fail to provide a consistent patient experience, your practice will see a sharp decline in your patient retention rates, in your new patient acquisition, and being able to retain those new patients that you get. You'll probably play that game that a lot of offices do, where you're just playing to insurance and you're spending a lot of marketing dollars, maybe $10,000 a month, if not more, trying to attract enough quality patients to get and maintain just for overhead spend. I know a lot of different people in offices are spending anywhere between 25 to 40% of their revenue dollars on their overhead. And so we want to get those numbers down. And the only way to do that is by increasing the patient lifetime value. That's number one. And number two is you could do that by patient retention, right? You want these organic sort of marketing referrals in that path. So you have to not compromise your patient experience. So you can't just haphazardly throw myofunctional therapy into your office. You can't be like, okay, hygienist, I'm going to throw you into a course and you're going to take this course and then you're going to come back and you're going to know how to do all the things. That doesn't help. The whole team has to be on board. Everybody has to be aware. You have to establish a system if you're going to be profitable. Otherwise, you're going to look at it and you're going to say, this doesn't work. Why are we implementing this thing that consistently doesn't work? I talked to so and so and so and so, and they've been struggling and they've been doing airway and they've been doing this, that, and the other, and they can't figure it out. How are we supposed to figure it out? Because a lot of these hygienists or dental professionals, no matter who they are, because a lot of people are being taught a lot of things, a lot of your team members who are going into these courses are not coming out with all the information they need to establish systems, and more specifically, systems that cater to keeping a seamless patient experience. So let's talk about how we're going to do that tonight. We're going to use my 5-step process, okay? Merge, MERG. We're going to start out with how you can manage your expectations. Then we're going to move on to educating the team, reviewing and revising, gradually rolling out and execution. Don't worry, it's all going to come together. But with this 5-step process, I guarantee you will establish a seamless system. Now, this is not like some cookie cutter system. This is actually going to be very catered to you. And I promised you actionable information, and I guarantee you applicable information is on the way. So, we're managing our expectations. This is the part that is the most critical. Your patient experience and your clinical experience are of the utmost importance. Okay. So, how do you maintain that? Well, there are some questions that you really have to dig deep and you have to understand within yourself in order to be able to facilitate having this implemented accurately and efficiently into your practice. So, what is it that you want out of having myofunctional therapy in your practice? Like, what is it that you're looking for? So you're almost designing how it's going to be. Where are you going to implement this? Do you have a space for it to be implemented? Do you have a spot where you are thinking, yes, okay, this is going to be where I'm going to, set up my shop, set up my office. In office, we're probably not going to do myofunctional therapy almost ever in a dental operatory. So, do you have an actual office? Right? Do you have a space where you can designate for myofunctional therapy? Because that's really, really important that you know what it is that you're going to do, where you're going to do it. I'm sorry. In office, you can offer myofunctional therapy, or you can refer out, or you could do like a hybrid. It's a nice combination of two. So you don't have to implement myofunctional therapy and actually have a myofunctional therapist in your practice, or you don't have to train someone to be a myofunctional therapist in your practice. What you could do is you can train someone. I'm sorry, is you can hire someone who's already trained, right? So you can or create a contract situation where they are now like a specialist that you're bringing into the office on such and such times a month and so forth. Then you have to establish something entirely different. How do you want that referral relationship to look? That's something you'll probably co create, but you need to already have an idea in your mind because they're not going to come to you with it. You have to know how this is going to work for your patients and your patient experience. So if you're planning on referring out, make sure you understand entirely how it is you want that referral relationship to look like. Okay. Then we're going to understand how we're going to create these outcomes. What are all the important considerations that need to be thought of when it comes to contracts? What are the fees? What are the responsibilities? Responsibilities winds up being the biggest issues that people do not overcome early enough in their experience integrating myofunctional therapy. So, what I have in mind as a myofunctional therapist as to what it might look like if I'm working with you or I'm working with your practice or I'm working inside of your practice is not necessarily what you might have in mind. And so, what my roles and responsibilities might be from my end, and what I think I'm responsible for, and that you're talking about in your office, might be entirely different messaging from what I'm offering your patients because I think that's why you were referring them. To give a better example, I have a wonderful release provider that I've worked with for several years now. I find them to be the very best release provider by far, hands down. And no, it's not somebody that you know. It's actually somebody who's spent a lot of time underneath all of the people that you do know in order to become as proficient as they are now. But this provider only cares about releases. All of the other stuff, she's like, you just deal with that on your own time. Okay. You want to deal with proper oral rest posture, mouth breathing, like whatever. You deal with that on your own time. I want pre and post op. That's it. Don't talk to them about anything else. Talk to them about how we can get our optimal results from our tongue tie releases. And then everything else, when they're done and they've healed, if you want to talk to them about starting a program, then cool beans. But until then, no, had we not had that conversation and made that distinction, who knows what would have happened, right? I probably would have gone in there and started talking to everybody about the value of myofunctional therapy. That's what I do in my practice. When people find me online, oh, I found you on YouTube, I found you on Instagram, I found you here, or such and such. My doctor didn't tell me about myofunctional therapy. I had to fall into it. So those are people who come in with blind eyes, and I just go through the entire spiel. I'm talking about the value of a whole program. They may have gone online and became Google experts, right? They got their PhD in Googling. They were able to look up all the information about tongue ties and they understand they need a myofunctional therapist. And all they care about is the pre and the post. But that's not what I care about. As a therapist, I care about offering the highest standard of care. I want to execute with excellence. So I'm looking at how can we create and co-create a relationship that's going to be mutually beneficial and not confuse patients. These are important things for your contracts. You want to look at all types of things. There are so many different things and variables that you want to look at. But as you're managing your expectations, start thinking about what those are, right? Do you want some exclusivity? Do you want to have a certain number of hours that they are responsible for having in your office a month or a week or so forth? You make it as niche as possible, bring it down as narrow and as close as possible. That way you're able to negotiate because these contracts have to work on both sides. It is your patients. Please value them. Um, and then how exactly are you moving this referral process along? So where are the referrals happening? Are they happening at the front desk? Are they happening in the back in hygiene? Are they happening with the assistant after restorative? Like when are these referrals being made? How is that going to work? How are we going to create an outcome that's going to be as smooth as possible for our current patient experience? So when you have your patients and they're already traveling through your current system and your current experience, where exactly would they have those types of conversations? That's probably most likely where you're going to implement your myofunctional therapy and put that on. Okay. When you're managing expectations, It's essentially curating what the day is going to look like. How do you want this myofunctional therapy to look as you're going throughout your practice in your office? How are you going to get it to fit in seamlessly? And how is your day going to be managed as a result? You want to educate the staff. That's our E. Okay. This is how you're really going to excite your team and be able to get your team on board, because there's absolutely nothing that you're doing in office that, if you don't have that patient understand entirely before they leave, that's going to be successful. And myofunctional therapy can be very difficult. It's not an easy concept for everybody to grasp. I mean, it's a lot of explaining that I do on a daily basis to people of all types of professional levels. I talk to physical therapists, I talk to speech language pathologists, I talk to occupational therapists. I've had all of those types of people as my clients, like as my patients who have worked with me. I've had doctors who I have to explain things to. There are so many people who don't really understand the flow and what exactly myofunctional therapy is. You have to get your team on board. But let's take a step back, because we have to remember, what exactly is a team? It's not just a bunch of people you've hired and thrown into a practice. A team is something that you've built. This is the foundation of your practice. These are the people that are the face and the representation of what it means to be XYZ Dental. Okay. So, whatever your practice name is, that's not really how they're identifying it. When they think of your practice, they don't have an image of your building. They don't have an image of your shingle. They have no image of that at all. What they do have is a very clear image of what's happening in the real time. How have they been touched or affected by every experience they've had? So, from the phone call, from every email they've received, from every reminder, all these are touch points and opportunities that you have to make an impact on that patient and their experience. And so we have to understand that our team is so much more than just the people we've hired to put into an office. So we have to value them more and think of it really as a collaborative, a collaborative family type association that you've built up together, and you work together to ensure seamless patient experiences and enhancing patient lives, right? Providing exceptional value. And so when we consider that, we have to remember that we want our team to be as cohesive as possible. And so if I were to say, okay, I think you need a crown, and you need a build up, and you're going to need 3 cavities filled, and you're going to do that in the next appointment. Go to the front, you'll talk to Susie, she'll break down everything as per your insurance and what your benefits cover. And then you get to the front and Susie's like, well, yes, you need such and such, and it's going to be $800. Well, what is a buildup? Like, why do I need the buildup? Can we take the buildup out? And Susie's like, well, I don't even know what a buildup is. I have no idea. Doctor, what's the buildup? What do they need it? Can I take it off? Now I'm questioning this arm of your practice, okay? I am questioning it by a lot. How is it that I've gotten up to Susie and you have no idea what it is that I've been referred to do, but you know exactly how much it costs? That's shady. That's a little sketchy. I don't like it, right? And that's going to be the first red flag. But we would never do that. We have our staff educated, right? They understand how they should respond to things when they don't know, because you don't have to know everything. But things that are more common, like crowns or buildups or root canals, they should be able to describe in some sort of bare bones, because honestly, you really need to talk to everybody like they are fifth graders. Don't go above fifth grade level. So all of that professional jargon, save it. You're going to talk to Susie, you're going to talk to her about the buildup. This is how we're going to be able to fit and maintain that crown and keep it on and protect the tooth and the root and so forth. Like, you're going to talk to them at their level, at their, baseline knowledge level, but you're going to explain to them what it is that they do. So if you send them up and they go to the administrative staff at the front desk, and now they're talking to them about they would like to have myofunctional therapy, or they don't understand, the doctor just said myo something and they're going to mispronounce it every single time. But now You need your administrative staff to be able to confidently say, yes, this is such and this is why the doctor recommended it, and it's a wonderful thing. But how do you get them excited to talk about this kind of stuff? Honestly, the very best way, and there's other ways, and we're going to talk about that in a second on how to educate your staff. But the very best way is to start getting them involved in some level of myofunctional therapy. Have them helped, have a family member helped, have somebody involved being able to receive the therapy so that they know what the experience is like, how they can really amplify their own breathing, digestion, help their TMD, alleviate some of their ringing in the ears, their tinnitus, be able to help themselves. That way they can speak about it. If there is something, and there's always that excitement, right? We all know you go to a CE, you get really amped about whatever the content was, and then you want to go on and you want to bring it to the team, and the team is like, we don't have time to implement this. The best way to get them on board is really to start getting them involved. Alternatively, you could do a whole course or a conference where you're going to take the entire staff, make it a trip, and then the whole team is going to be there learning about how they can implement this thing and how it can really be helpful. Alternatively, you could provide them with a lot of reading materials. So when I was very, very young, I was watching a Kids' Choice Awards on Nickelodeon, and Will Smith, I will never forget it, a young Will Smith, very early in his career, I think maybe just started Fresh Prince of Bel-Air. He he won an award, and he said, kids, there's nothing else that you need to know other than everything you've ever wanted to learn has been written in a book somewhere. And that was it for me. Hooked, immediately hooked. And it does not fail to be true. There is no limit to how much education you can get once you start reading. So you can read anywhere online. Read, go through PubMed, go through Google Scholar. You can read and get all the research and the education, different journal articles. You can go through particular magazines on the subject. I can't tell you how many times Dental Sleep Practice has published myofunctional therapy articles. There's a lot of great stuff in there. I'm in there twice with myofunctional therapy articles. RDH Magazine, very big on airway. Dental Economics, they've got a couple of things on it too. You can read different books. Jaws by Sandra Kahn. I have my own book, Accomplished, How to Sleep Better, Eliminate Burnout, and Execute Goals. You can read Gasp, Michael Gelb and Howard Hinton. There are so many resources. It does not have to be as extreme as like, okay, we're going to spend $5,000 and take the whole team to San Diego to go learn about myofunctional therapy. It can be reasonable for this to be done without having too much overcommitment and overspend, but they do need to still learn. So one other way I find is really, really helpful for educating your team and getting them invigorated and excited, and it never fails, is to request a lunch and learn. So easiest way to find a myofunctional therapist is to Google myofunctional therapist near me. You Google that, and any myofunctional therapist worth their weight in gold is going to have a Google My Business page that you should pop up for you. Now, typically, unfortunately, the field is not, densely populated with a bunch of therapists. So it might be a little bit of work for you to find one that's nearby, for lack of a better word, especially if you're in a more rural environment. But there are plenty that do virtual lunch and learns or teach and treats. And essentially, all you want to do is you want to ask for what you want to know. So I teach for myofunctional therapists, and I teach advanced concepts, and I have a course on the lunch and leverage, the lunch and learn, right? How you can really make it a wonderful experience for the teams that you're teaching. The number one thing that they need to do is ask what you want to learn. But if they haven't asked you that, you want to provide that information. You want to say, hey, by the end of this lunch and learn, I really would love to know XYZ. I have yet to meet a myofunctional therapist worth their weight in gold who isn't excited to talk to somebody about myofunctional therapy. So if you can't find a local one, I'm happy to do a lunch and learn at any point in time. But a local one is really like key. They're going to get a lot of that live and in-person energy that you're going to want to really reverberate through the office as you're educating your staff. Okay. All right. Let's move on to the R. All right. So we're merging. So now we're going to assess and pivot, because if nothing else is guaranteed, we know that this flow that you may like, or that you may say, hey, I want to move this box here, or this box here, or that box here. This flow, if nothing else, is always subject to a pivot. So you're going to assess how exactly you want the flow of this therapy to be. Let's take a look at this particular flow that I designed for this presentation, and that has worked in some practices that I've worked with. So you can take from your recare appointment, your hygiene appointment, your hygienist begins to do the assessment. Then during the exam, seal the deal. The doctor is going to come in and, oh, it looks like you're right. The hygienist has found such and such, such and such. Now, dentist walks away, and all the time happens every time the patient goes like, what was that just happened? The hygienist now gets to re-explain all the stuff that you were probably already talking about during the appointment. Myofunctional therapy, why you think it's important for them, what's going on with their tissues and the different pressures, and why you think, the grinding is becoming more detrimental over time, and so forth. Then you can confirm and transfer that information to your administrative staff. So you take it to that front desk, and then they're going to do all the scheduling. Or you might want to look at it and say, you know what, I want the administrative staff to issue screeners. They're going to ask them certain questions. If they're struggling with this, that, and that, then the recare assessment, and then the exam. But we're not going to have the hygienist do the explanation. We're going to give it to the treatment coordinator. The treatment coordinator will be able to do all the explanation and then do the scheduling. Sometimes you make it even shorter, right? So it could be it's the recare exam, and then after that, hygienist is going to explain and schedule and do all of the other tasks that would come along with that, like treatment plan and present and so forth. So, however you're going to map your flow, it's important that you do map your flow, because now that you've got your flow, you're going to have to review and revise it, right? So, the key players that you have to consider in your flow are going to be, one, your hygiene department. That is probably the place where people spend the most time with the patients. They understand all the patient's pain points and chief concerns. They've been hearing these complaints probably for years for some of them. They can easily identify the problem and can quite simply explain the why. That's what we do. We educate as hygienists, right? We're constantly giving out that information. This is what's going on with you. This is why, and so forth. The doctor, however, has the most respect from the patient. So you have to consider that as like a different kind of hierarchy. So when I say something, and if I'm in hygiene and I say something, it doesn't carry the weight as when the doctor comes in and says it. Like, any changes in your medical history? No updates, no stroke, heart attack, cardiovascular events, da 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 da. No, all's fine. No medications changed. No, I'm fine. Doctor comes over, how you doing? Any changes in the medical history? Oh yeah, like 2 weeks ago, I actually was in the hospital. I had a cardiac event. They called it angina. Why didn't you tell me? I specifically asked that question. So one, it makes me look not very like I didn't do my job. But two, it very clearly shows that you don't think very highly of me and what it is that I do. And that's it is what it is. That's a whole conversation for a whole another time. But the doctor has the most respect. So that tends to reinforce anything that is said by that hygienist. So that really helps to take what would be almost an alley-oop. So the hygienist throws it up, and then the alley-oop is that doctor scoring the goal, scoring the basket in basketball, right? So it's really like reinforcing, this is what it is, and this is what you need, and so forth. So consider what roles for these two that you want to have in your flow. Now, the administrative staff is like the face of the office, right? If they know no one else, they know these wonderful gatekeepers that sit at the front, that answer the phones, that send the emails, that do the thing, that they know these people. And so they're really good and they know how to fit things in, how to schedule, how to present, how to really get these things to be solid as far as the information. So whatever information that you have, they're able to really distribute really, really well. So I find administrators to be probably one of the most valuable parts of the team because they're educators in their own rights. They wind up being the people who make it as layman term as possible. Okay. The treatment coordinator now is very confident in presenting treatment, and more often than not, myofunctional therapy is fee for service. Now, there's a lot of finesse that comes with medical billing for myofunctional therapy. Don't worry, there's a lot of great places where you can learn about that, MyoPathway being one of them. But they have to be confident with presenting treatment when it's fee for service because you really need to reinforce not only that they need it, but why. So if we go back to yesterday's training with our exceptional patient customer service, that's going to be a big, big win. Being able to clearly define the need and the why. And then presenting those fees and ensuring that there is that communication between the patient, the referral, or the in house partner, and so forth, making sure that all parties are adequately informed, that all the accounting is done, and that all the scheduling is done. We love our administrative staff. They're fantastic, absolutely wonderful. So these are the four different parts of the practice that you have to consider, and like who is actually going to be speaking about the myofunctional therapy and how you want them to fit into your flow. Okay. Gradually roll out. Don't roll out like big, bad, and bold, okay? Because that's going to be the biggest problem that you're going to encounter is that people are going to step back and be like, what is this thing that you're talking about? You're talking about, I need such and such treatment and Myo what? And doctor's lost his mind or doctor went to some new training and now thinks he's going to use me as guinea pig. No, no. It happens. It happens all the time. What you're actually going to do if you're gradually rolling out is you're going to start assessing everyone and you're going to start saying, we're going to hold and take a look on this. Okay. So it looks like we're seeing you've got a lot of cheek biting going on, your temporomandibular joint. We've got some muscularly involved strain that strain that you were talking about, that strain pattern, it's coming from the muscles. And we're learning and constantly evolving in our practice. And we've learned some new things. And we're definitely going to keep an eye on this. I want you to be on the lookout for this, this, and this. And then let me know how that's all going over the next 3 months, however long, next 2 weeks until we see you for restorative. And then we'll talk to you about the possible solution that we have, however long it is until you see them again. When you see the people who are like big red flags, the people who are sitting in your chair, you're hearing them breathe the whole time, they're struggling, really hyperactive gag, orally defensive, the people who you're like, whoa, 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 you needed Myo like 10 years ago. Those are going to be the people that you start to really roll out with. You start to test your experience and your flow. So you don't want to roll out and have it be every patient every time. You want to roll out and make it be just the high risk ones. High risk people, they're going to get all the information. They're going to go through the whole flow, and everyone else is not, because if nothing else is guaranteed, shift is, okay? So shift will happen. You'll have to pivot. You'll have to switch out things. If you're gradually rolling it out, nobody notices the difference. And remember, what is the most important part of the integration? That it does not impact your patient experience. By rolling it out in full force, doing a hard launch and making sure that every patient, every time is being told about myofunctional therapy, you're going to impact negatively your patient experience. So we're going to take baby steps, and it'll be the most important people that need to know this information, need to know it. That way, if there is something that you need to pivot and move and revise, You can do that. You can go back to mapping the flow. You can remap the flow. You can revisit that, right? That was that whole R. And then gradually roll that out until now you've got a seamless system that works really well with your current flow. Okay. And finally, you're going to execute, which is the most important part. You got to be able to pull the trigger. You got to know what it is that you're going to be able to achieve at the end of all of this, because it has to present a value to the practice. It has to present a value to the practitioner and the patient, right? So you're going to know and be able to differentiate that by looking at these different variables. Have you increased your competitive advantage? So, is your office distinguished from any other dental practice that's in the nearby area? Well, with 1% of dental practices actively practicing myofunctional therapy as a specialty offered within their practice and or referred out from their practice, yeah, I'm pretty sure you almost always will improve your differentiation of your practice and increase that competitive advantage. Does it improve patient satisfaction? Because an improvement in patient satisfaction improves patient loyalty and retention. We talked about patient retention yesterday. Patient retention, as per Harvard Business Review, you increase patient retention by 5%, as little as 5%. That has a 25 to 95% direct correlation to an increase in your practice revenue. And that's going to be the biggest value add that you can know just by your retention rates going up. And if you're not keeping a good eye on what your patient retention rates are currently, you need to go back and take a look at things. Okay. Did it help increase patient load? We want a direct relationship where now these people who are now being better retained, right? Because they've got improved satisfaction and they're more loyal, are now bringing along others. So that's that organic marketing. Okay. That's going to reduce your overhead on marketing spend because these people who are sticking with you, who are increasing their patient value and their worth to you, are now also bringing along family and friends for these same fee for service offerings that you have. So, does this help increase your patient load? Is it helping to increase sales of related services? So once you get into myofunctional therapy, you might find yourself falling into the rabbit hole where now you want to be offering tongue tie releases or airway, and you want to get into all the different appliances, or you do more referrals out for ortho, or you're doing more clear aligners for expansion. There's several different companies that are offering that. Don't think that there's just one. There's a lot of different places where you could do clear aligners for expansion. But if you're looking at the value of what it is that you're putting in after you've rolled it out, you've executed, and you're executing with exact excellence, now you're going to see all of these numbers start to increase and start to shift. And that's going to make a big, big impact on the bottom line. Okay. So we're looking at this jungle now. It's got a nice little path, right? That path wasn't there earlier, but now you're seeing the path, that 5-step, the merge, where you're managing your expectations, you're educating your team, you're reviewing, revising, you're gradually rolling out, and then you're executing. It's going to make seamless integration absolutely possible. It's going to make what seems like very difficult, very hard to implement, absolutely smooth sailing all throughout. Okay. So I love this quote by Wilbur Ross. And so I think it's incredibly important to include it. But it's always great to have a sound idea, but the really important thing is the implementation. And it's always great to say, okay, I really know that I need to do something different for my practice. I really am interested in offering myofunctional therapy for my practice. I just don't know what it would look like, and I don't know how to implement it. It's great to have that idea. But if you fail to implement the idea, it's not going to be beneficial to you and your overall growth. Because like I said yesterday, what got you here to where you are now, if your practice is just smooth sailing and you're looking for the next thing to take it to the next level, you're looking to add a little bit of innovation, a little spark of integrative services, because you know that's in high demand currently right now. 1 in 3 Americans are actively seeking that from their medical and dental providers when they're online. And 80% of America is going online and Googling first first before they ever step foot into any healthcare practice. Okay, so you know that this is an on demand, an in demand offering. This is important that you start to take what bits you got out of this education here in this 40 minutes with me. Then you start to take that information and you actually start to implement it. Okay. So even if your first step is just starting to read more or attending more of my live lectures or watching more of the replays or going backwards and looking at all the information and education that you can find for free in the Myo community on Facebook or on my YouTube page, where some of you might be watching now, I really think it's important that you start to implement. So, how can you implement? Because I did promise you not only my 5 steps and how you can excite your team, but I promised you different options for various practices. Well, you can take a totally hands off approach. So, Spur Dental Wellness is designed exactly for that, for a hands off approach. That's actually using myofunctional therapy as a membership. So, it's more of a referral based membership. If you're looking to refer and have your office have no additional work, okay, you're short staffed, you don't have the team, you don't have the bandwidth to actually start implementing, or you don't have someone nearby so that you can get this implementation done, you want to refer and let it go and know that the patient is going to be serviced, well, then if you use Spur Dental Wellness, that's your ability to use Myo as a membership model where you are the member. You are a member of Spur Dental. Your practice is a member of Spur Dental, and you get to do unlimited referrals. So you're sending people out. We don't charge them anything extra. I do have some doctors that do charge something to the patients in exchange for being able to get the referral information and so forth so that they can access a myofunctional therapist. But this is essentially going to give your patients access to do one-on-one calls with a myofunctional therapist. They'll be able to see a therapist every couple of months, and they have unlimited email and support, technical support, and it's for various types of issues. So whether it's poor vagal tone, hyperactive gag, parafunctional habits, mouth breathing, or TMD, there are programs that we have with a specialized myofunctional therapist who's on call waiting to talk to your patients as you refer. So they don't get charged anything extra, which is wonderful for you because you know that compliance or the idea that they're going to go through with the therapy is actually going to work. So you can visit spurdental.com to get more information about that. If you're looking to do it just part-time in your practice, so you're like, I don't want completely hands off, I want something to do with it. Well, our myofunctional therapist at Spur Dental Wellness is an expert in the Myo Mind Shift method. So that's more manageable Myo, where you have these 5 types of programs and you're able to understand how you can implement it and work with people. So you get all the workflows, you get all the exercises, you get the different programs, and it all integrates seamlessly. It comes with a workbook. It's a 2-hour self-study lecture. That's myomindshift.com. StreamYard always messes up and throws off my slides. So it's myomindshift.com. And that's much more manageable. That's Myo in bite-sized forms, or you could take it all the way. You're like, I don't want to do just some part-time thing and I don't want to be hands-off. I want it actually implemented in my practice, and I want to know that I can do that proficiently and profitably. How do I get that done? Myo Pathway is the key way. Setting a new standard in the industry. Dental professionals are 3 times more likely to lose their investment in myofunctional therapy courses and education than any other professional. So we know that there are a lot of other professionals that are practicing myofunctional therapy. They are more likely to get it off the ground than you as a dental professional. And that breaks my heart because myofunctional therapy started in dentistry, started with Edward Engel. It is something that we should really own, and we are really the key place for it to be provided. So Myo Pathway is a 28-hour AGD PACE approved course. And in that course, you get 26 hours of high-level education. So you're going to get all of the basics. You're going to learn the exercises, you get forms, you get resources, you get all the things that you can get literally anywhere else. But then on top of that, there's advanced education, medical billing, cranial nerves, vagal tone, CBCT, working with special cases like cosmetic cases or cases that have certain types of deformities or defects and so forth. How do you work with these special cases, these special needs patients? Dental sleep medicine, working with appliances, these are things that are not being taught in other courses. While other courses are focusing on all the basics, we're focusing on how you can take your introductory level to the next level. And the only way that you can really start to implement that, because having a lot of knowledge is wonderful, but I can never imagine if I went to hygiene school and after hygiene school, all they gave me was a book and I got a lot of education about what hygiene is, but never ever did anything in person, hands on, like clinic, and never got to actually scale or hold an instrument or, whatever, and have an instructor over me as I'm doing that. All of that was essential. We are tactile learners. We need that type of information. We need that type of feedback in person and live. Myo Pathway is the only course that is offering 16 hours, so 2 8-hour days at no additional cost, zero additional cost for the cost of the course, 2 days of in-person mentorship. So coming to you to work with you as you work with patients, you get real live feedback, education, modifications, and so forth. And so it's a course that is eligible for certification, CE. It's absolutely wonderful. Highly recommend, and that's myopathway.com. So there's 3 ways you can really take this, okay? You can take this and you can take it as a small step where you're really hands off and you use it as a membership, or you can take a bigger step and you can go part-time and do the Myo Mind Shift programs until you feel more confident. And then you can take it all the way where now you're able to help with advanced cases and do above and beyond. Okay. I am so honored to have been able to be with you here tonight. If you have any questions, please do leave them in the comments. This is streaming over LinkedIn, YouTube, and Facebook. So I'll be going to all 3 places to see what all the comments are and how I can help you. Please let me know if this was valuable to you and then what future lectures you would like to see, because I plan on being on once a week, every week, to give you something tangible that you can utilize so that you can start to implement this thing that I am so passionate about will change your life. Hope everybody has a great evening. It was just an honor. Bye, guys.